Hello,
Hello,
listeners,
listeners.
and welcome to Beyond the Mirror. This isn't just another podcast, it's a deep dive into the world of beauty, wellness, and longevity. Now, we're here to discuss what beauty really means beyond just appearances. We'll also talk about wellness, the habits and practices that keep us healthy, full of energy, and we'll explore the topic of longevity, looking at the science and realities of living a long, fulfilling life. So sit back, relax, and join us as we go beyond the mirror.
Hello, listeners. I am excited to be back with another show. I don't have Dina with me today, but I have another amazing guest that we are excited to have on. His name is Dr. Gary Wiele, and he is a biological dentist. And we'll teach you a little bit more about what that means and other ways to keep yourself healthy through your mouth and other tips to keep your mouth looking good, from a cosmetic standpoint as well. So, welcome to the show.
Well, thanks for having me.
So, let me start with you've been in dentistry for how long?
40 plus years.
Wow. Yeah. So, you've seen a lot of change.
A lot of change.
Yes. So, what brought you to shifting from traditional dentistry to biological dentistry? And then also, what is that? What's the difference?
Well, in biological dentistry or holistic dentistry, we're trying to take dentistry from being a factor to your health, a negative impact. And so it's just kind of like eating clean, but for dentistry. So one of the things is we're learning a lot more about electricity these days. And there are some holistic medical practitioners that use different electric means of diagnosing and looking at things. And different interferences happen with metal. So one of the things we do in biologic holistic dentistry is keep metal to a minimum. And, we have zirconia ceramic implants these days. You really don't need the titanium. Now, they do one technique called the all-on-4 where they pull the person's teeth out and they put these implants in at different angles. You see it on TV all the time. But that is a specialty type thing, and they're very difficult to clean. So cleansability is very important with everything that we do. We want nice, smooth edges on everything because we don't want the plaque to grow on the teeth. The plaque's going to grow even if you don't eat sugar. It's going to grow from dead cheek cells sloughing from inside your mouth. So the plaque grows, we knock them down. The plaque grows, we knock them down. And that's what you need to do on a daily basis. Everybody needs to do that.
Sure, sure. And I can attest to, when I was growing up, metal fillings were the thing, mercury fillings, which I don't know why we ever thought that was a good idea.
Well, mercury fillings brought dentistry to the masses.
I see.
Before that, it was gold and very expensive. And so the normal Joe was able to get a filling. So dentistry fell in love with it. And, but they are 50% mercury. And we were taught in school that all the mercury is tied up in the filling.
Mm.
But technology has traveled forward, and currently they release gas. And so the mercury gas, the mercury vapors, where does it go? When you wear them away, where does that go?
Right.
And some people, it doesn't bother at all.
Sure.
And other people, it can be an issue.
Sure. There's always differing levels of sensitivities to all kinds of things.
Yep.
Like for me, I did have you remove them for me. I wasn't really having any health issues per se, but I'm on a mission to be as healthy as I can. And that seemed like a logical part of the process to me.
I don't disagree. It's a case by case, individual by individual.
I hate going to the dentist, so like most people. So biological dentistry is focusing, it's kind of like holistic medicine. We're not just like, you have a symptom, here's a medicine for that symptom. In biological dentistry, you're looking at the whole body, the effects of what's happening in your mouth and how it affects the whole body. Right. And I think that's a newer, like, how long has it been that people really were aware that your teeth can affect other parts of your body?
Oh, it's been quite a while. Maybe dentistry hasn't done the best job of educating everyone,
Mm-hmm.
but the public is catching on.
Yeah. Yeah. I mean, like for me, the first one that I learned about was the link between gum health and heart disease. And so can you explain that a little bit further?
Sure. The gum attaches to the tooth, kind of like how your skin attaches to your fingernail. And there's a trench created there. We call it the sulcus, and that's where bacteria grow. And so the deeper it is, the more anaerobic or oxygen hating they are, and the more virulent the bacteria are. And so if the gum bleeds, any bacteria in that trench can then enter the bloodstream. So they've breached one of the defense mechanisms. So keep it clean, and you can do different antimicrobials. There are people concerned now about antimicrobials um, affecting nitrifying bacteria that help produce nitric oxide.
Okay.
I haven't really seen that as an issue, um, but we're not testing for it yet, so we
Sure.
really don't know. But I like peroxides, hydrogen peroxide. Your body makes hydrogen peroxide to kill bugs,
Mm-hmm.
and the anaerobic bacteria, the bacteria deep in the sulcus, don't like oxygen. So let's give them some oxygen.
And so then how is that? So it's basically helping with your nitric oxide load?
No, the hydrogen peroxide changes the environment so that the bad bugs no longer want to grow there.
Okay.
And so they leave. And when they leave, so do their toxins. And the gum is healthier for it.
Okay.
It can recover easier. The body has less antibacterial load to deal with to maintain things.
So that's helping with not just the heart, obviously. That's helping with the whole body.
Yes. And, the oral cavity initiates digestion. So if you're eating tons of bad bugs, I mean, it's interesting. You see people come in with plaque all over their teeth, and they say, "Oh, my stomach isn't doing too good," and well, let's clean things up,
Mm-hmm.
and see how it changes. Then you can add some probiotics, et cetera, et cetera.
Okay.
But stop the negative effect.
Sure. And so you can essentially begin that process in your mouth, but most people are completely unaware of that.
That's correct.
And so when you say hydrogen peroxide, how best do you recommend it to be used?
Two ways. The easy way, the poor man's way, is water pick.
Okay.
50-50 peroxide and water, and flush it around that moat, so to speak, that goes circumferentially around every tooth. And that's why I still am a big flossing proponent, because the two sides where the teeth touch each other go virtually uncleansed unless you get something down in there to disrupt those bacteria.
Okay. So regular flossing also.
Yes.
Okay.
And then another way is the perio tray. And that's a custom-made appliance, patented FDA approved. It seals around all the gums. We put a hydrogen peroxide gel in that, and it smooshes down underneath the gum and between the teeth. And so you're bathing that area, almost like a hyperbaric chamber for the gums.
And so is like the water pick the good place to start for someone, but if they have some more severe issues, it's better to go the route of the tray?
Yes. Now, the tray is also a convenience factor.
Mm-hmm.
It can be part of your routine. I can pretty much guarantee if you have bleeding gums, you do it twice a day for 10 to 15 minutes, the bleeding is going to stop.
That's great.
And so then, let's say morning shower, some kind of chore. Whereas the water pick pretty much ties you to some form of a sink
Sure.
with all the splatter.
So you can travel with the other one easier. Although I've seen portable water picks
There are
now.
portable and, yes, rechargeable, battery powered.
Yeah. Doesn't seem like I haven't played with one of those, but it doesn't seem like it would hold as much water, obviously. How do the smaller travel ones get the water?
You have to fill them.
Okay, yeah.
So 50/50 peroxide and water, I mean, you can pre-mix it, take it, or just put a splash in.
Sure. So what other health issues can be tied to your mouth?
Well, probably one of the big ones would be TMJ issues and the wearing down of the bite. So everything wears, the teeth wear away. Cosmetically, you hit about 50, early 50s, you might want to start thinking veneers and rebuilding things.
Mm-hmm.
So as the teeth wear down, the body posture changes. And so we want to prevent wear to the teeth. So let's say you have a bunch of teeth worn down. Well, then you have to make a decision if you want to restore them. Where do you restore them? Do you put back that which has worn away, or do you just restore them where they are? And so then that takes into consideration all three dimensions in the mouth: the vertical dimension, and like Invisalign will work on the arch. It works in 2 dimensions. It doesn't do a lot in the third dimension, which is the vertical.
Like how everything's combining together?
Well, they will articulate those, but they don't change the height, which is the distance between the nose and chin. So as your teeth wear away, the lip, the vermilion border where ladies put lipstick, tends to roll in the mouth. And if you put that height back on there, then there's a lot more lip.
So cosmetically, even your face looks better.
Yes.
You look younger.
Uh-huh. And it's a very important thing, in my opinion, with children in the mixed dentition. So mixed dentition is after they have their first permanent molars and before they get all of their permanent teeth. Set up the orthopedics in a 3-dimensional way so that when their teeth come in, maybe they won't need braces, or maybe it'll be a small fix.
Right. So I know there's other, have you studied much? I know there's a lot of meridians also that are associated with certain teeth affecting certain parts of the body. How much validity do you give to that link? Like one specific tooth is tied to your pancreas or whatever.
Well, it's very interesting how that plays out oftentimes. So that comes into play. Let's say someone has an infected tooth and they don't even know it. You can have an infected tooth without pain. And then they have a system that's ailing. And we do x-rays, et cetera, and we find an infected tooth. And they have that treated, whether it's pulled or root canal. There's a little controversy with some people on root canals. After that is taken care of, then the problem gets better.
The other physical problem gets.
I mean, you're using a lot of energy to fight an infection, even if you don't have pain.
Sure. And how often is it that people have infections in their mouth and they're completely unaware of it?
Fairly often. It happens a lot.
So is that where your 6-month visit is critical? Like, are you going to catch something like that when someone comes in, or do they have to be complaining for you to be able to notice that it might be going on?
Yes, we can catch that.
Mhm.
And, as a new patient, obviously you're starting out with a full set of x-rays and periodic exams. We're measuring around the teeth. We're measuring the depth of that trench. And sometimes you'll have an area where the trench suddenly gets very deep vertically. Well, that's a red flag to take an x-ray and see why.
Okay.
Why is this changing?
I noticed, like, technologically coming here was a much different experience than every other dentist I've been to. Your initial oral exam was incredibly thorough, and you use a lot of technology. Like, I never had anybody 3D image my mouth before.
Well, we don't 3D image every mouth. We do problem areas, generally speaking.
Okay.
Now, some dentists will do the whole mouth, the whole head. That's a lot of data to go through.
Sure. But I was still impressed with, like most of the time I'd come to a new dentist, I'd get a basic set of x-rays, they'd sit me in the seat, they'd look at my teeth, and that was it. And I was here for almost an hour the first time when you were just checking me out. So what kind of extra tests are you normally, or what kinds of things are you looking at in that scenario?
Well, we look at a number of things. The wear patterns on the teeth tell us things. If your jaws click and pop, that tells us things. So the bite functions is designed to function in a certain manner. And if it's not functioning in that manner, things are going to wear out faster, or you're going to get divots on your roots. And so, again, we want dentistry to be able to just be status quo, boring checkups. And then how do we deal with those other things? But, it's my opinion, you have the right to know what all is going on.
Right.
And the airway can be related to dentistry. And snoring, you have the upper airway and the lower airway. And the lower airway, the back of the tongue can shut off and actually obstruct it. And the tongue is also attached to the lower jaw. So those interactions are important. So we screen for those things.
Hmm.
And then if there's something that is a finding, then we'll delve deeper.
What when someone's coming in here, and and I think maybe even like what made you transition, like, and how long ago, from doing kind of what everybody was doing to kind of, you know what, I think I want to look at more that's going on here. Like, what was the inspiration to kind of push you in that direction?
Well, I started with the 7-year itch.
Okay.
Um, the boring of filling holes, and then it becomes a money thing, and it just isn't fulfilling.
Yeah.
And so then I stepped into the TMJ angle, and as I began that, I had my own battle with cancer. So through that, I was juicing, and then studied herbals and essential oils, et cetera, et cetera. And so it's just been a progression, really.
So you kind of, it's actually interesting in this wellness industry. There's a lot of pain to purpose stories. It's really common.
It's like, I want to get you over here.
Yeah.
This is going to happen to you so that you go there.
Yeah, well, and it's more too that's part of a lot of people going, okay, I tried all this traditional stuff and it didn't work for me. So now what else is there? And I'm not going to just give up, So let me see how these other things. And I tend to be skeptic first, and then trial and error, and seeing other people and how it's benefiting.
We are in Missouri.
Yeah, it's tough here. It is.
Show it to me.
Yeah, that's right. That's right. So then let's talk about something a little bit controversial, and that would be fluoride. How do you feel about fluoride versus non-fluoride toothpaste? What are your thoughts?
Well, in dental school, we're taught that if they ingest fluoride, a certain amount of fluoride, you need to call poison control.
Right.
So it's a neurotoxin, and what we're saying is that fluoride makes the tooth crystal, the tooth is a crystal, slightly imperfect, and so then it's better. So I have a little difficulty with that. And it works for areas of decay, it kills bacteria.
Mm-hmm.
But then the question is, how much are you taking in?
Right. How toxic is that? What
Mhm.
is it undoing what you're
And then
doing?
how are you an excreter? It's just like mercury. Are you an excreter? Are you an accumulator?
And so in that scenario, are you talking about toothpaste or in-office fluoride treatments or both?
Both. We'll as the public comes along, I want to treat what you want. I'm not pushing my agenda. I'm here to serve you.
No, I'm the same way in my office.
So if you want fluoride, um, I'm happy to give it to you, but I'm not going to push it on you.
Okay. Yes, because everywhere else I've ever been, that was just a standard. It was like, this is just part of the process. And like I pushed back on that. And, and then as I started to investigate more and learn about toxic, like toothpaste has a label on it, a disclosure about the toxicity of it. like they're legally obligated to tell you that it is toxic. How do you feel about the hydroxyapatite? There's a lot of new toothpaste with that in it instead.
True. I'm so far I'm fine with it.
Do you believe that a lot of them claim that it rebuilds the surface of the tooth tissue, or is that
They do have some data on that. Practically speaking, in my practice, I've seen it help decrease root sensitivity.
okay?
I haven't seen any cavities go away yet
Okay, so you haven't seen any reversal, but
of decay.
you've seen other benefits that could be useful.
Yes.
And what about things like essential oil gumdrops and things like that? Have you played with those at all?
Essential oils are very powerful. So, um, what oils and what are you trying to do, and how does it affect the oral biome?
Mm-hmm.
So, um, and that just depends on um, what you're trying to do with it. I'm pretty okay with any of it, but there are some powerful ones. I mean, oregano is very powerful,
Yeah,
and
I know a lot of the oral gumdrops have clove in them too, but I don't understand essential oils. That would be Dina's. She's not here today, but that's her forte. But I've seen data about it reversing or helping with gum disease or preventing gum disease.
well, some of them are very antibacterial.
Okay, so that's what it's doing. What about the tongue scraping? What do you think about that?
I like it.
You like it?
Uh-huh.
So what does that actually do?
Well, like I said before, the cells on the inside of the mouth left,
Mm-hmm.
and so you're just getting rid of those dead cells.
So you're like, it's like when I exfoliate someone's face.
Pretty much.
Yes.
Tongues really vary. There are some tongues that are like a shag carpet,
Interesting.
and some that are smooth as glass. So it just depends on the individual.
Do we have any idea why there's that variance?
I don't know.
Not known yet. Yeah.
The Chinese have a whole thing on tongue diagnosis.
Yes. My acupuncturist is very into whatever's going on my tongue when I go to visit her. She's smart like that. What kind of things can you do to help improve maybe oral microbiome? Because, like, again, the whole digestive system begins in the mouth. So you were saying earlier, sometimes you fix oral things and you have digestive improvement. Are there suggestions that you have for oral microbiome to help improve the bacteria, having the good bacteria in there?
That really is for your physician. who is managing the whole system.
Okay.
I have a couple probiotics that I like. I've tried many of them. There's one circulating on YouTube now about it melts in your mouth and rebuilds enamel. I've not seen that. I bought a pack of those.
But you haven't seen the effect from it yet.
I haven't seen, but I have shared them with some people, and they said it helped them.
Okay.
So.
And so in those scenarios, it's like specific strains that seem to be more beneficial to oral microbiome.
Yes, and I think we're just starting to get into the age of strains with the testing. We know a lot of strains that are virulent, cause issues, and it's interesting how there is a war going on inside our mouth, even though we don't know it.
Well, and it goes all the way down to the end, to the other end. It's all moving through. Like I know, like for us, we like to see a little higher bifidobacterium, or actually for virus prevention and reduction of viruses and colds and things like that. But yes, I don't think it's an exact science. I do think it's all being sort of an evolution where we're figuring it out.
I agree right now. And 20 years ago, if you would have thought about eating things for your bugs.
Yes.
Crazy.
I have a whole book that's like, eat to prevent disease, so it makes sense that the whole system plays together, it all has an effect.
If I overeat, I'll take a bug. Clears it right up.
That's right. Well, that's a joke women say when they come into the spa all the time, like, oh, I just had a great bout of flu and I've lost 10 pounds and I feel better. But, or I just need a good flu before I get the stress. Something like that.
That's a lot to go through.
Yeah. So what kinds of tips do you have? Like, if you were kind of saying, I would do these 5 things for my tooth and gum health, or however many you want. I don't care how many there are. What would you recommend, or what do you do for yourself at home? Like, I always do X, Y, and Z.
Well, I always have a thorough brushing and interproximal cleaning at night.
And do you prefer electric or a regular toothbrush, or does it matter?
I don't think it matters.
Okay.
They have some data of the electrics having the right pressure. So some people get carried away with the manual.
Yes, I'm an overbrusher.
And try to saw them off. But some of those divots at the gum line are bite related and not overbrushing.
Okay.
So there's a lot of, I would say, misinformation in dentistry about that.
Okay, so good brushing. Do you do that first in the line of things, or where does that go in the order?
Usually, I think flossing first and brushing afterward is a little bit better, but I'll take whatever you want to do.
And do you think there's a high percentage of people that are good about flossing, or you think most people are not good about flossing?
I think most people floss some. Yeah. And they don't do the day to day.
So you would like to see that every day?
Every day.
Twice a day?
I'm okay with once a day.
Okay.
Let's just be consistent with once a day and see what we get.
Yes.
And like for most people, that will satisfy.
Yes. So my daughter and I both have very tight teeth. And for me, flossing is the difference between cavities and no cavities. Like night and day difference. Mm-hmm. And so once I figured that out, I'm like, well, that's kind of a no-brainer now. Like that's got to be part of the process.
Okay, so a couple other self-help. Let's say you have a clicking jaw or you have jaw pain and you get headaches. Mm-hmm. A clicking jaw when you bite all the way down usually means that the disc is out of position. So reposition your jaw in a different place and see how it impacts the noise. For example, move your teeth tip to tip and open and close. And how does that impact the noise? And you can do something very similar for someone who snores. Breathe in deep through your nose with your teeth together.
Mm-hmm.
So some people have a better airway when they clench their teeth together as opposed to when their jaw is completely relaxed. So test the airway at different positions. So breathe through your nose forcibly, biting down on your back teeth, and then try a different position. A lot of times you can line up the lower front teeth to the upper front teeth, and it feels like a weird position. Look in the mirror and see if you can line those up. And then if it feels like a weird position, you're probably doing it at night.
Clenching or
grinding.
Okay.
So the brain follows the oxygen all night long. And if it dips below a certain point, the brain will awaken you. You don't know you're awake, but it kicks you out of the sleep cycle. And it often does that with a grinding forward motion, just like before you give somebody CPR, make sure the airway's open.
Mm-hmm.
The brain will do that, and then you have to, you breathe, your heart rate goes up because you have to reperfuse all the oxygen-deprived tissue, and then maybe you're back to sleep again.
So what can you do to help with that?
The gold standard is a CPAP, but for mild obstructive sleep apnea people, we can make dental appliances. And the dental appliance will control the position of the jaw.
While you're sleeping?
Yes. And sometimes that is the difference between apnea and no apnea. So again, check and see how jaw position is related to the condition. Some people snore, they put their teeth tip to tip, which is usually a couple millimeters forward and some millimeters open.
Mm-hmm.
And then they can make a snore noise. So there are a lot of appliances on the market for that. And of course, I have my own appliance for that.
Yeah, that's not been one, but I know like you and I have discussed an appliance because I'm a clencher, a stress clencher.
Well, do you want to wear them away or keep them beautiful?
Oh, we'll get it there.
I mean, if you wear them away, you have to restore them all.
Yeah. How expensive is that when people have to do veneers?
It depends on how many you're going to do. You're talking usually somewhere in the $1,500 a tooth range.
Wow. Yeah, that's a lot. An oral device is a lot cheaper than replacing all your teeth.
Yes, ma'am. And nothing looks like a virgin tooth.
Yeah, I believe that too.
The veneers can look really good though these days. We have some good ceramics, good bonding agents.
Is that a hard process to get it done? I mean, what makes it so expensive? The actual product or the process?
Both.
And does it take a long time to do veneers? Like, is it a progressive thing, or you just do it all at once?
There is a setup for sure, and there's doing it, and there is bonding them in and adjusting them, make sure the bite's right. The whole thing is the process.
What do you recommend? Okay, so one of my personal pet peeves, I worked in dermatology for quite a while, and one thing we saw regularly was this perioral dermatitis from whitening toothpaste. Over and over and over again. This wild rash around the nose and mouth, and 9 times out of 10, you remove the whitening toothpaste and it goes away. And then if they put the whitening toothpaste back in, it comes back. So what do you recommend people use to whiten their teeth?
I like peroxides.
Okay.
Mm-hmm.
So
I think the tray system is the best.
Okay.
The perio tray I was talking about earlier, that works. When you use the white strips, and the white strips can be effective for a lot of people, but the material goes everywhere. You're really not controlling the material. And some of the chemistries are stronger than others, and strong chemistries on a root surface can create sensitivity.
Okay.
So with the custom tray system, you can direct the material right where you want it to go and prevent a lot of those negative feedback.
So then you get tooth whitening improvement along with your improved gum health, basically.
Yes, in that period condition. Yes.
I just bought a device that has light therapy for your teeth.
Okay.
Have you seen any of those be effective for gums or health, or like it's got red light and it's got full spectrum?
Well, we know red light increases mitochondrial function. So healing, energy, all of those should be ramped up.
Mm-hmm.
So I don't have a problem with that.
So then, any other kind of last thoughts, last tips, things that you think everyone should be doing?
We'll think of 10 things in about 5 minutes.
That's fine. It's fine. I mean, I've had enough tooth problems in my life. Actually, when I was going through college, I just had just terrible things happening with my teeth. And ironically, my poor daughter is actually having the exact same situation where I can't figure out if it was what I was eating and she's eating, or what she's drinking, or what I was drinking, what was causing the problem. But I did figure out with time how to take care of my teeth in a way that seemed to stop that craziness.
Mainstream dentistry has looked at this a little bit, but oral pH can be a factor.
And how can you affect that?
Well, sugar tends to lower it, and alkalizing minerals tend to raise it. So your dark leafy greens, etc. But now you're kind of starting to cross over into the biochemistry, which should be managed by the physician.
Have you ever played around with the humic and fulvic acids for dental health? Have you ever looked into that at all?
I have a shot every morning.
So for me, that like dead stopped my cavity. So it's something that I do every day because it really, for me, it helped me get off, lower some, like I'm insulin resistant, so it helped me with that. It helped me with my teeth. And I always wonder if that's a remineralization thing or what's happening.
I have a friend who has low oral pH, and he does fulvic and humic every day.
Okay.
So it's not affecting him in that way.
Okay, so it's not benefiting the
It might
pH.
just have been what turned your biochemistry around.
Okay.
Or maybe you detox something.
This could also be true. Absolutely. 100%. It was so strong I had to you had to start by taking a bath in it. It was that potent.
Wow.
But now I can take a quarter teaspoon a day, which doesn't sound like much, but that's a lot of this particular product. So anyway. Okay, so how can people find you for more information if they're around here in the St. Louis area and they'd like a better approach to their teeth? Like, how can they find your practice?
You could probably Google holistic or biologic dentistry, and we have a website, drwiele.com will get you here, WIELE. That's not our main website, but
it has some information.
It should get you.
Okay. And then is there a lot of dentists doing what you're doing? Is that growing? Is it stagnant?
It's definitely growing because the public wants it.
So people are seeking it.
Yes. And
to me, that's great because the more I learn about teeth, the more I'm amazed at how the direct link to the body, and it's just it's wild, and so many people don't know.
I could go way nerdy on you right now. But.
Yeah. Well, I appreciate you for coming on, and so much knowledge and information. I hope people took nuggets and go home and start trying some things to improve their dental health, and hopefully they'll come in and see you as well and have a nice, really thorough exam, which I've never had before.
Well, great. Well, thanks for having me.
Absolutely. And Thank you, listeners, for listening in. We appreciate it. We hope you would share, review us. We're still new and we could use the love. So please share this information with your friends. This is important and people should know it. We want to make a quick but important disclosure. The information and advice shared in this podcast are intended to provide general knowledge and understanding about wellness and health-related subjects. They are not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health